vaccine mandate for students 12 and older in LA public schools. Would you tell your kids to get vaccinated?
Oh, I absolutely wouldn't.
All right, and in that interview, he cited a lot of data we were interested in. Perhaps some of the reasons that studies show 65% of parents say either absolutely not or they will wait to see before vaccinating their kids. Professor at Washington University in St. Louis of data science, features editor of the Harvard Data Science Review, Liberty Vittert, also my parents' favorite daughter, joins us to crunch the numbers. All right, Liberty, you look at this in totality for kids. COVID more dangerous or the flu more dangerous?
In a word, they're about the same. So a lot of cherry picking of the data has been happening here. And if you look at the past year, there's only been one reported death by the CDC of a death from the flu for a child, but that's really cherry picking the data. If we look at apples to apples, which is the 2019 to 2020 year before we had masking and all of this stuff that were lowering the flu deaths, we saw 195 deaths of children of the flu in that year, which is almost exactly comparable to the number of COVID deaths in that year. And we also hear a lot about hospitalizations and people talking about hospitalizations. And in fact, the number of children hospitalized with the flu this year has been 3 to 4 times that of the number hospitalized with COVID. So in that sense, the flu is much more dangerous.
Okay, so that is what you're protecting against, either COVID or the flu as a baseline that we all understand. But there's some dangers specifically to kids for the vaccine. Do we have enough data to understand that yet?
So anytime you're looking at taking a vaccine, it's a cost-benefit analysis, right? So what are the risks of getting the vaccine versus what are the risks of getting the disease that the vaccine prevents against? And there is preliminary data that especially in young males, if they take the mRNA vaccine, which is either Pfizer or Moderna, that there is a real increased risk in myocardial or pericarditis, which is sort of an inflammation of the heart. And absolutely that risk is higher than their risk of dying of COVID should they get it. So the preliminary data is really showing absolutely no support for mandating vaccines in children.
Fascinating. And certainly, we only got about 20 seconds, but certainly a lot more kids die from other things than they do of COVID and the flu combined, right?
If we're looking at things that we should really care about our children, more children die of pneumonia, COVID, flu, cancer, and opioids combined than COVID. So gun deaths account for 1/3 of child deaths. Those are the things we should really be concerned about.
All right. We're going to hope to talk to Dr. Ladapo about that and his new role as Florida Surgeon General in the coming days. Liberty, thanks. We'll be right back.